All right, so my name is Dr. Berg Martinez. So to differentiate me from the other two, I'm a psychologist, which means I do not prescribe meds. We have the slides.
Trying to get to it.
Okay, so we are going to have Q&A later, but I just want to get a feel for kind of who we have in the room. Raise your hand if you think or know you or someone you love has ADHD. Okay, raise your hand if you are a parent of someone that you think or know has ADHD. Okay, so a lot of parents. Okay, so that gives me a good idea of who I'm speaking to. Raise your hand if you're just here for the free snacks. Okay, all right, next slide. Okay, so I'm a licensed clinical psychologist. That means I do psychological testing for ADHD. I treat ADHD. I do a lot of coaching. I work with schools a lot, dealing with the impact of ADHD. I work at the Center for Individual and Family Therapy. We have 5 locations across Orange County, and I think we are one of the main referral sources for your church. So you can always find me on our website, Sep19.com. I also supervise at the Counseling Center at Vanguard University. Next slide. And next one. Next one. Okay. Okay, so you've learned a lot about what ADHD is. There's a few things I want to hit on and review with that. The first is that it's a neurodevelopmental delay. So that means that it's a measurable difference in the development of those parts of the brain and how they function. It affects between 8 and 11% of school-age kids. Those are the age group we primarily see and treat this for. Symptoms continue into adulthood in about 3/4 of the cases. As you heard from Dr. Frommel, the symptoms might reduce as the brain develops and catches up in those areas of the brain, and people learn ways to cope. As they become older, they learn ways to manage their ADHD, and so it doesn't impact them as much as they get older. Is this on? Can I walk? Can you guys hear me? Okay. All right. What I want to highlight here is that the challenges with emotion start in the brain itself. So if you have that part of the brain up front that isn't working as it should, I like to think about that part of the brain as the part that says stop, don't, wait. If that's not communicating to the emotion center, so part of the difficulty of the ADHD is not just that those areas of the brain are smaller, it's also that they're less connected. There's less connectivity to the other areas of the brain that control things like emotion or impulse or our motor center of our brain. So if the motor center of our brain is saying, go, 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 move, 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 wiggle, 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 and the front of our brain is not telling it, no, don't, wait, stop, this isn't the right time, that's where you get that restlessness, the hyperactivity. If the emotion center of our brain is saying feel, 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 and the front of our brain is saying not the right time to have an emotional outburst, not the right time to break down crying, not the right time to scream, then you get these emotional outbursts. So the problems with the emotional part of ADHD start in the brain itself. Okay, so what your child is feeling is really normal, but the way they're expressing it, the way they're able to modulate it is the problem. Okay. So what causes ADHD? You heard a little bit about this. Really, we don't have one single cause for ADHD. It's highly genetic, but there are some of those factors that Dr. Jamal hit on. The most important thing I want you to hear is that you did not cause ADHD in your child. You didn't make them watch too much screens. You didn't not read to them enough. There's nothing you did as a parent that made your child have a different brain. This is partly just atypical neurodevelopment, okay? Those social factors can impact how that child experiences the symptoms of the ADHD, how it impacts their functioning, how it impacts them at school, with peers. That's where you can kind of come in, but it's not your fault. It's also not your child's fault, okay? Your child is not doing these things on purpose. They're not trying to make your or their own life harder. They're doing the best they can, just like you are. Okay, and blaming yourself is not helping anybody. Blaming your child is not helping anybody. Okay. All right, we can go to the next. All right. So, executive functioning skills. When we talk about the deficits in that part of the brain, what we're talking about is the impact on executive functioning. Raise your hand if you've heard the word executive functioning in relation to ADHD. Okay, raise your hand if you know what that means. Okay, not so many people. So we talk about it a lot, but we don't really like talk about what that actually is a ton. So it has to do with the way that they're thinking and what they're doing. Next slide. So I want to break this down for you guys. So working memory is a part of the executive functioning skills that are less active for someone who has ADHD. So if we think about working memory, what I want you to think about is this is kind of the mind's playground. So we use imagery in our mind, we hold information in our mind, and then we manipulate it in our mind to get an outcome. So this is like the basics of doing like mental math, right? Okay, 2 plus 2, I hold 2, I hold 2, I put them together, it's 4. Okay? People with ADHD have deficits in working memory. They also have difficulty with planning and prioritization. So part of what that frontal lobe, that part of the brain that's a little bit smaller in people with ADHD, is helping them with hindsight and foresight. So in my mental playground, can I look back to my previous experiences and figure out how I need to change my behavior based on them? That might be information I've learned before. That might be facts about math. That might be, when I did this last time with my friends, they didn't seem to like it very much. So how can I use that information and then apply it to the future? That's foresight. This is more difficult for them. They tend to live more in the moment, okay? It also is a part of thinking about what's important to focus on. So again, if you're focusing on everything, you don't have the prior brain that's saying, ignore that, it's white noise, it's not important, and you're paying attention to everything, it's hard to prioritize, right? You can go, and then for organization, then it's keeping track of that information across time. How am I going to use this information? What are the steps by step that I need to do in order to reach a goal? Next slide. So you have this in a single handout with all this information, the examples. It's the blue one. Thank you for raising that up. But it's really important that you as a parent or you as someone who loves someone with ADHD or if you have ADHD, that you understand that these are some of the weaknesses. Again, these are not things your child or your spouse are doing. Okay, time management or time blindness. One author calls this myopia to the future. So what we want to be understanding is that your child doesn't have a good sense of time, moving across time. So a lot of times you hear for ADHD, the intervention is, oh, just give them more time. Now, if you give someone more time and they have no sense of time, how do you think that works? Not so well, right? It's like the day before Christmas, just extending forever. Like time moves like molasses. So instead of doing something like just giving more time, we do things like give them time off the clock. So you have 15 minutes to complete your math homework, but you can break that 15 minutes up across as much time as you need. Okay, let's do 5 minutes. Take a little dance break. Let's do another 5 minutes, and then we go to the bathroom, and then we do another 5 minutes. So it takes longer because it's broken up, but the amount of time they're staying on task is still the same. Okay? And then metacognition. This is kind of the mind's voice. It's our internalized speech that tends to happen kind of in early childhood. We start to think through things and we start to talk to ourselves. This also helps us evaluate how we're doing and think about how we might want to change things. Okay, next slide. All right, response inhibition. This is the stop and wait part of the brain. And then emotional control is managing emotions so they're more socially acceptable. When's the right time? What's the right place? Who are the right people where I can let this out? Okay. So these are really the basis of self-control when we think about self-control and why kids with ADHD have trouble with self-control. The stop, wait part of the brain is underactive. Their ability to control emotions is underactive. This is why you see them acting impulsively. And then sustained attention. So this is, again, like ignore the kid in the back of the classroom who's making a fart noise and just focus on the teacher. This is the don't look at all the stimulation all over the walls of my preschool classroom that's super colorful and has lots of things to look at. Focus on the story time. It's the part that helps you focus in and ignore. All right, next slide. All right, task initiation. This is why people with ADHD have a really hard time getting started. So they find everything to do in their house before they start working on the laundry. Or maybe your teenager ends up cleaning their room for the first time in their entire life on their own, so that they don't have to start cleaning their room before that's due tomorrow.
memory stick.
So it's getting the thing started that's really hard.
Picture.
Goal-directed persistence, this is self-motivation. Being able to put off, not be distracted by competing interests, and stay focused to get the thing done. So it's not just difficult starting the thing, it's difficult staying on the thing until it's done. These are all difficult. And then flexibility, revising the plan as we go. All right, next slide. Okay, so you've already heard a little bit about this, some of the risks of untreated and undiagnosed ADHD. School failure, substance abuse. I do want to just stop, because you've already heard most of these things, I do want to stop on the substance abuse. There is a lot of myths about substance abuse and ADHD. People who are not treated for ADHD do have a significantly higher risk of using substances because they are trying to self-medicate. They are trying to get their brain to work, or because they're dealing with the after effects like depression, anxiety, low self-esteem, they're trying to feel better. But people who are treated for ADHD, the research is really clear that either they go back to baseline, meaning they don't have any higher risk, or that the risk is actually lower. Some studies show it's actually lower than the general population. Because guess what? Their brain is not working how it's supposed to. Okay? Next slide. Okay, so when we talk about comorbid diagnosis, that means having more than one diagnosis at the same time. As you heard, this is more the rule than the exception with ADHD. So one thing that you want to be thinking about is not just does my child have ADHD, but what else could be going on with the ADHD. And you want to make sure that if you're getting treatment for your child, that those things are being considered by the school, by your treatment provider, therapist, or psychiatrist. You want to make sure that you're looking at the bigger picture. A lot of times these things get missed, in my experience. So if your brain isn't working like your peers, and then you're finding yourself interrupting in the middle of your junior high, girls' social group, and then you're getting weird looks because you just interrupted and you just said something that was kind of inappropriate, and now you feel ostracized, and now you're feeling withdrawn, and now you don't know how to make friends, and now your friends don't like you and they're making fun of you because you said that funny thing that didn't really make sense in the moment. Your self-esteem goes down, you become more depressed, you become more anxious, you start to pull back your energy from school because school isn't a place where you find success, you start getting behind in classes. You can see where the cycle kind of just spirals. This is why it's so important to get kids with ADHD help. It used to be thought of as like, oh, it's like a more minor diagnosis. It's really not. It has a huge impact. Okay. So you heard a little bit about the medical conditions that mimic ADHD. In my experience testing kids for ADHD over the last decade, there's a lot of things that people miss as a comorbid diagnosis, or they misdiagnose ADHD because it's actually one of these other things. These are the things I've seen most commonly. Trauma is a big one because trauma disrupts our ability to do a lot of the same things. It makes us not concentrate. It makes us a little bit more hypervigilant, so we're looking around the room. It can look like I'm distracted when really maybe I'm just making sure my environment is safe. So if we aren't looking for these things to make sure this is not what's going on instead of ADHD versus with ADHD, then we can misdiagnose a child. And if you put a child who has anxiety but not ADHD on a stimulant, raises their heart rate, which is a signal to the body that you're anxious. So it's really important if your child is getting diagnosed with ADHD, it's by somebody who understands the comorbidities and the things that they need to rule out. Okay. All right, so this is where I want to spend most of my time. Is on effective treatment. So that first one that we just talked about, evaluation. You want to make sure you have a clear evaluation where they've looked at things like they ruled out anxiety, they've ruled out trauma, they've talked to you, preferably they've met with the school or talked to somebody at school, or at least gotten a rating scale from a teacher. You want to make sure it's a thorough evaluation. This type of evaluation can be done by the school or it can be done privately. So a lot of times what I do in my role at the Center for Individual and Family Therapy is either I'm consulting with parents and walking them through the process of getting this evaluation done at their own school, at their home public school, or I'm doing the evaluation myself, or I'm supplementing the evaluation that was done by the school. Because a lot of times the school will keep a little bit more focused on learning, whether or not they have attention issues, but they're not necessarily looking at things like, do they also have anxiety? Do they also have depression? Could this be something else? Okay. The second component of effective treatment is family education and training. So this psychoeducation basically means teaching you guys about psychological stuff. So teaching parents, teaching teachers about the impact, just like we're doing right now. Look guys, you already checked one off the list. Give yourself a round of applause, good job. Thanks for it. All right, reducing shame and blame is a really important part of family treatment for ADHD, because a lot of times people in the public will like look at you like your kid's, like what's wrong with you? Like, can't you get a handle on your kid? Anybody ever have that happen where like you get the look, right? So it's important that you don't internalize that blame that you're getting from the public or from other people who don't understand. You don't put that on your kids, because that's one of the things that can increase things like anxiety and depression. Also, parents of children with ADHD tend to have more family discord. They also have a higher divorce rate because this is a stressor. So it's really important that the family is getting treatment and the parents are involved. Okay. Parent and teacher training is a part of that as well. So teaching you, how do you support your kid? Okay, if their executive functioning system, this part of their brain is delayed, how do I create an external working system for them? How do I create an environment that's going to minimize the impact for them? And how do I set up systems for them that are going to help them be as successful as they can? Okay? Child skills training is actually the smallest component of ADHD treatment. So if you are seeing a therapist with your child for ADHD, and you drop your kid off, and then you go sit in the waiting room, and then you go pick your kid up, and that's the treatment, your child is not being treated well for ADHD. You need to be heavily involved. This child skills training is actually the smallest component of their treatment, because their brain is different. We didn't change their brain. So it's important that we're creating something around them. And then changes to the environment, both at home and at school, are important. We'll talk a little bit more about school in a little bit. And then medication is the fourth important component for kids with ADHD. So for kids 4 to 6 years old, so below 4, we really don't have good standardization because there's just such a wide range of development between 1 to 4. 4 to 6, really the recommendation now is that behavioral interventions, being parent training, teacher training, environmental changes, are the first line treatment. And if those aren't effective to reduce the impact, then medication. After 6, medication and behavioral interventions combined have the best outcomes, which is shown again and again. It should be both. Medication alone isn't enough, and therapy alone is often not enough. So what I want you to think about is, you see this kid with the prosthetic leg. So if your child was born with missing a leg, you would go to a doctor, you would get a prosthetic, you would bring them to physical therapy so they learn how to use it. Over time, you have to change the prosthetic to fit them as they grow. They may have to get more physical therapy. And they would be able to participate, right? Like they'd be able to go to recess and play with their friends. They'd be able to, walk in the grocery store when you're going grocery shopping. They'd be able to participate in life. However, they are not necessarily going to run the same. Things are still going to be a little bit different. Medication is like the prosthetic. Physical therapy is like the therapy. Okay? So therapy, we teach them to use the difference in a way that's effective, that minimizes the deficits that they experience in their life. So you wouldn't then take the prosthetic away and say, now run! You can run, you learned how to run, now you don't need it, right? Because their brain is different, they still need it. And we need to wait for their brain to catch up developmentally and then try taking away the prosthetic, see how they're doing without it, okay? So when Dr. Jamal talked about really getting them through that developmental period, that's what we're talking about here, okay? So, really therapy is a parent and child partnership, with the parent being the most important piece. So some of these slides are a little bit out of order. I played with them a little bit last night. So I myself have ADHD, so one of the ways that I've learned to cope with that is that I do a lot of editing, and I do a lot of reworking, and I reorganize things, and I put them externally, put all the information externally, and then move it around, because they have some deficits in my mental playground, right? So your slides are a little bit outdated as a result. So child and parent partnership. So we change the physical or social environment to reduce the problems. So that might mean things like reducing distractions. So maybe you set up a homework spot for your child that is not next to the TV. That is not where there's a lot of traffic flow in your house. That doesn't have a bunch of toys around it. It's more kind of a neutral space. Maybe you organize the house in a way that's more conducive to them. Maybe you create a bunch of like labeled baskets for where their toys go. So we're creating external organization systems. We're reducing the distractions in the environment because their brain isn't doing it for them. Okay. We change the nature of the tasks that they're expected to perform. So that might mean that you're chunking, meaning you break things down into steps. So if they have 20 math problems that they have to do, maybe you take that paper and you snip it in 3 pieces, and so then they have to do 5 or 6, and then they bring it back to you and you give them a high five, or they get an M&M or some sort, or a sticker or something, and then you give them the other piece. So we want to break it down into smaller chunks. We might use checklists or charts. I love using like white erase boards or laminate pieces of paper for kids that help break down the steps. Okay, so what are the things we need to do today? Okay, let's write them down. Let's break them up. Okay, you've got 15 minutes of reading. Let's break them into 5 minutes of reading, 5 minutes of reading, 5 minutes of reading. And then you have, oh, which one do you want to do first? These are the things we have to do today. Okay, let's check it off when you're done. So we help break that down for them in a visual way. Daily and visual schedules can be really helpful for routine because, again, they're having trouble prioritizing, they're having trouble organizing their time. So maybe we use a visual schedule where we're having set points. So I hear a lot of times a set point is homework. And anybody have homework problems with kids, even if they don't have ADHD probably. Getting out of the house is a big one, and bedtime routine. Those are probably mealtime. Those are probably the big set points I hear a lot of. So creating a visual schedule where you have pictures that represent the steps they have to go through. So bedtime routine, put on pajamas, brush your teeth, get in bed, read a story, say your prayers, go to sleep. Where you have pictures for each of these, and then maybe they get to check each picture off as they go. We want to break it down, make it visual, make it external to the brain, okay? Using timers is really helpful because these kids don't have a good sense of time. So I love kitchen timers, or like you can download apps that have timers that are visual, that kind of like show the time ticking down. That lets them know like, okay, the time is winding down, we're getting there, and like halfway through. So that can be really helpful for them. So for example, if a kid is like going from like TV time to bedtime routine, which can be a problem, right? Who wants to give up TV to go to bed? So maybe you use a timer. Oh, you've got 5 minutes left of TV time, and then it's time for bed. And you put the timer in front of them. And when it goes off, they now have a sense of it, the time winding down. And then change the way that the caregivers or other adults interact with the child. So this is really where the parent coaching comes involved, the teacher coaching comes involved. This is providing things like movement breaks, positive reinforcement systems, problem solving as a team, so teaching your child how to solve problems, which is not actually something that they inherently know how to do. Develop a homework plan with your child, limit their choices, and set small reachable goals. Really, we want to set them up for success. We want them to show what they can do, not what they're having to fight against to do it. Okay. All right. So there's some evidence-based programs that are specific to parent training. When I say evidence-based, that means there's all this research that says, hey, this actually works. So some of them, parent-child interaction therapy, the Incredible Years program, I'm trained in both of those models. The Triple P is kind of like Incredible Years, but it's on an individual basis. And then the New Course Parenting Program. So these are just different models of how to teach parents positive discipline behavior management strategies. They all have a few things in common. One is that they focus on positive relationship and positive discipline, meaning that we use things like rewards, praise, good feelings between me and you to try to change behavior. So they're non-punitive. It doesn't mean that there aren't consequences, but the consequences are minimized in favor of more positive strategies. Okay? So these programs have benefits that are maintained in the long term, because guess what? You, as the parent, set the environment for the child in the long term. So if we can teach you to change things, that change will happen across time. They also show that parents who attend more training sessions see greater improvements in the child's behavior. And as a caveat, parents who have untreated ADHD themselves may be less effective in using these programs. You can probably guess why, right? And it's about 25 to 35% of parents who have a child with ADHD have ADHD themselves. Yes?
Is that one or both parents?
It's that a parent, one of the parents. Okay. All right, so how do you improve a child's executive functioning skills if you can't magically like wave a wand and change their brain? So you start with goals that they can achieve in small steps. So if your goal is that they do their 15 minutes of reading, so that's what the school says, you have to do 15 minutes of reading every day. But they're only doing it like one day a week because all the other days it's like a meltdown. Then you don't set the goal at doing it 5 days a week right away. You set the goal at doing it 1 day a week right away because then they can have success. Part of what we want them to start to do is believe in themselves. So you set the goal where they're actually already achieving at first. And then week 2, okay, now the goal is to do 2 days of your 15 minutes of reading. Once they have achieved that, now the goal is 3 days, and then we move it up. It's really important you don't set the goal somewhere where they can't achieve right away. You teach the deficit skill explicitly. Don't expect them to just learn this by osmosis. Okay, so that means that if they are having trouble with time management, you teach them how do you manage time. You say, okay, these are the things you have to accomplish. This is the time you have to do it. This is how we're going to do it. We're going to break it down. We're going to plan our time. We're going to stick to our schedule. We're going to use a timer. So you make it explicit. You also want to really understand their level of delay. So kind of the rule of thumb is it's about a 30% delay in those executive functioning skills. So if you have a 6-year-old, you can estimate approximately that they are functioning with the executive functioning skills of a 4-year-old. So what can a 4-year-old accomplish? What could a 4-year-old handle? Set your expectations there, okay? And then you want to move from the external to the internal, meaning you change the environment first, and then you help the child use those environmental things. And you want to really use rather than fight their innate drive for mastery. Like kids don't want to not do things. Like kids want to master things, they want to feel good, they want to figure it out, they want to say, I did it! So we want to use that drive and encourage that drive, okay? And then you're going to modify the task to match their level. Use incentives to augment their motivation and their level of instruction. So that means things like stickers, high fives, label praise, like, you did it, that was awesome. Like that is an incentive. To feel that feedback, to feel those good feelings is an incentive. Stickers are awesome. A little like prize box if they do certain things is great. So it's okay to use different incentives, like this isn't a bad thing. And then provide just enough support for them to be successful, and then you're going to gradually pull the support back and let them take control over it. Okay. So children with ADHD need increased accountability because you may have said, okay, go to your room and go clean up your room. Now, how many steps is there to clean up a room of a child with ADHD? 57, 58, something, a lot. So put your toys in the hamper, or put your dirty clothes in the hamper, put your Legos in the box, put your books on the shelf, make your bed. So these are all different things that they have to do to accomplish this bigger goal. So what you don't do is say, go to your room and clean up your room. What you say is, go to your room and put your Legos in the box. And then you don't just leave them to the mystery of what's happening. You go and check. Oh, you forgot to put your Legos in the box. Please put your Legos in the box. And then they put the Legos in the box. You put your Legos in the box. Good job cleaning up. Please put your dirty laundry in the hamper. Break it down and check on them, okay? Act, don't yak. Meaning they don't need a lecture. This is not information deficit disorder. They have the information, they just can't use it. So keep your sentences, your commands, your directions really short and sweet, and then follow up. Okay, if you say, it's 5 minutes before dinner time, please go wash your hands. If you wash your hands, you get to pick the vegetable today. Then act on it. Don't lecture. They have the information, they just can't access it because their brain is different. Okay? Keep the EROs close, so event, response, and then outcome. You want to make sure that the consequence is paired really closely with the behavior. Consequence could be good or bad, the reward or the punishment. It needs to be close to the event, close to the response. So it's not usually a problem that your consequence doesn't work as much as it is the timing or the delay in the consequence that's not working. So a kid who has this time blindness, if you say, well, you didn't do your homework today, so you lost screen time tomorrow. Guess what, it's tomorrow. Are they thinking about yesterday's homework? No. Keep them close together. So instead of doing something like you can earn screen time at the end of the day, if you do all of these things all day long, you break up the day. Okay, if you keep your hands to yourself and don't hit your brother before breakfast, you can pick a song in the car on the way to school. And then, on the drive home from school, pick something else. So chunk the day up. Don't have big consequences that are delayed. Also, big consequences in general don't work because then, one, you're running out of consequences as a parent. Like your house is now void of all toys. Has anybody have you ever gone nuclear as a parent where you're like, you're never ever having candy again for the rest of your life? Now what are you gonna do at the next piñata party, right? So keep those consequences small and more frequent versus big, huge ones, okay? All right, so one of the things I coach parents on is how to give commands effectively. So a lot of times that means touching more, talking less. So if I'm talking to my child with ADHD and they're watching TV, how much attention do you think I'm really getting? Not much. But if I go up to my child, I turn the TV off and I say, it's time to wash your hands for dinner. You get the eye contact, you've made physical contact, that's way more likely that your child is actually absorbing that information, okay? And keep it really short and sweet. All right, so reinforcers, a lot of times parents have funny feelings about this a little bit, like, well, am I rewarding my child for something that they should already be doing? The truth is, you have to kind of make up for the deficits of that internal reward system by using external rewards. That's not a bad thing. You're just helping them get motivated to do the things they need to learn how to do, the things that are hard for them. So if something's really hard for me, like I need some sort of incentive. Like if my doctor tells me, you really need to start working out more, what's the incentive? I don't know. But if he says, you know, you need to start working out more, and if you join a gym, you actually get a 50% discount in your deductible, oh, okay, I can do that. There has to be some sort of incentive for these things that are really hard. All right. And part of what you're doing with consequences and rewards too is you're kind of peppering the environment with artificial, quicker tied rewards and consequences from the natural ones. So our natural consequences tend to come a little bit later, particularly as we get older. Like if we don't do our homework, we don't really like feel the sting until the next report card. So you're peppering the environment with artificial rewards and consequences to help you fill the gap in time between the behavior and the natural consequence. All right, how am I doing in time? Okay, let's see. Okay, so yeah, let's skip this. We're gonna skip ahead a little bit here. Skip this one. All right. So for example, you might partner with your child to teach problem solving. So first, you teach, I don't know if this one's in your handout. First, you teach problem solving. There are actually steps of problem solving. 1, identify what the problem is. 2, brainstorm like crazy without judgment. So maybe the problem is you're not getting your homework done. What are your solutions to that problem? Never do my homework again. Okay, never do your homework again. Do my homework and then get a bowl of ice cream. Do homework and then get a bowl of ice cream. Do 5 minutes of homework and take a break. So you just brainstorm. You're not judging. Step 3, evaluate. Okay, your first idea was never do your homework again. What's the good and bad of that? The good is I hate homework. The bad is then I fail, and that's probably a bad thing. Okay, so you then evaluate once you brainstorm like crazy. Kids with ADHD will come up with really cool ideas that you never would have thought about. So really you want to engage their brainstorming, engage their creativity, then you help them evaluate. All right? And then once you've evaluated, you pick a solution and you try it out and you see if it worked. So that's the first thing you've done as a parent, whatever the problem was. Maybe the problem was homework. Then you're going to practice the steps with a real problem that they faced. you decide on a script for yourself. It's really important for you as a parent to stay calm in this process because children with ADHD tend to be dopamine vampires, and when you get elevated emotionally, they're like just sucking all the dopamine out of you. So what you want to do is stay really calm so that their energy is going to the problem, not your emotion. So it helps if you come up with a script for yourself, a script with your child that you're going to say every time this problem gets faced. So maybe this script is, this isn't working for me. This isn't working for me. And then you do broken record. Now for those of you who are younger, a broken record is a thing where like if a record got like a scratch in it, it would just loop the same thing over and over again. So you're going to broken record it. And then once that problem occurs, you use that broken record. So maybe it's getting out of the house in the morning before school. Oh, we've had a failure to launch. Failure to launch, failure to launch. It helps engage the child back in that process that you've already set up with them. Or maybe you use a question like, are you feeling like a cheetah, a dog, or a turtle? To help your child recognize their state. Asking them questions like, what happened there? Oh, it's time to get out of the house for school. What's going on? What do we need to do next? Or maybe you debrief. Yes? It is not in there. You can also email me, and I'm happy to like send you anything. So, yeah. I imagine there's some ADHDers in the audience today. So that's fun. Or take a picture. Good tip. See? Problem solving. I love it. Okay. So then once you've had a problem, you debrief. So this is where you're going to engage your child as a co-problem solver. Instead of just saying like, you did it again. I thought we got over this. You're going to sit down and say, oh, you've had a failure to launch again. What happened there? What do we need to do differently? What are your ideas about that? You are helping engage their problem-solving process. Now, this is going to be really rough and painstaking at first because you're teaching a new skill. So give it time. Be patient with your child. Be patient with yourself. All right. Next. Okay, so child training, the most minor part of treatment is child training. Research really shows that, especially with younger kids, child training is kind of a waste of time because they don't have the executive skills yet to use the child training, but we will supplement. So you're going to informally teach those executive skills through like everyday activities. Like guess what it takes to make a meal at the end of the day? A lot of executive skills. You have to plan things out. You have to do things step by step. You have to know where you're at in the process. You're timing different things. So that's where you're going to break it down for them, and you're going to talk them through it. Like, okay, we are going to make dinner. Let's figure out our process. So that's a great opportunity to teach them informally the executive skills. All right? Teach them to write things down immediately. They do not have that mental playground in the same way as their peers. So having like a physical notepad in their pocket can be really, really helpful, okay? Just write it down. It's like a running joke in my house. If I didn't write it down, it doesn't exist in my brain. Oh, that's a great idea. Can you text me that after I hang up the phone? If it isn't written down, it doesn't exist, okay? Teach a child to break things down into steps and make it fun, all right? Next slide. And then you can formally teach them social skills, executive skills. So for example, cleaning a room. You teach them, then you test directly. So I'm going to say, okay, let's start now. Time is starting now. Put your trucks in this box. I know you hate doing this, but you're almost done and you're going to feel so great when your room is clean. Now put your dirty laundry in the hamper. Oh, you did it. It's awesome. Look, oh, there's still a pair of pants. Put those in. Oh, nice job. All right, we did it. Look, your room, your whole floor. I can see your carpet again. It's amazing. So you're going to keep that energy up. You're going to keep the enthusiasm going. And then you're going to slowly pull back. You're going to fade your supervision once they've got a handle on it. All right, next slide. Just really the only take home with this is that social skills do not get taught in the therapy room one-on-one with a therapist. Research shows that just doesn't work. They need to be taught in the environment where they're actually interacting with peers. And it's really less so much about teaching direct social skills, so that can play a little piece of it. It's really more about coaching in the moment. This is why doing social skills groups are helpful, doing like lunch pail programs at school are helpful, but you want it to be with actual kids that they're interacting with. Because how they practice a social skill with an adult is not the same as a kid. So part of what I do with parents a lot is called social coaching. So I teach the parent how to coach their child socially. So when they're on the next play date, they know how to support that skill in the natural environment. All right, next slide. Okay, So school involvement, one of the roles I play a lot with these cases is getting involved with schools. So that might be things like training teachers in positive behavior management skills, helping the parents set up daily behavior report cards, helping them have consistency across different environments so that the things you're using at home that are working are getting used at school and can work there. It might also mean that you're advocating for a 5-year floor plan or an IEP, which more formalizes the supports they need. And then medication and academic achievement. So when a child starts medication, first the impact it has academically tends to be on productivity. Then after about 2 years is when you see the academics really catch up. So first they're able to actually focus in on the material, not just 1/3 of the day and 1/3 of the year, but they're able to absorb the information more throughout the year. Then you see them start to catch up academically after about 2 years on medications. So don't expect like you popped your first Concerta for this child and now they're grades are going to be an A, okay? All right, next slide. What does not work for ADHD? Non-directed play therapy has not been shown to work for ADHD. Again, if you're dropping your kid off at a therapist's office, you have no idea what's going on, you're not involved, this is probably not effective. However, if a child has one of those comorbid conditions, like anxiety or depression, non-directed play therapy can be helpful for that. Insight-oriented therapy, or like psychoanalysis, I'm a big fan of this, but this is not a lack of insight. ADHD is not a lack of insight. It's not a lack of self-understanding usually. That can usually be done more in just a psychoeducational session, like let's talk about this. It doesn't have to be something that's ongoing long-term. High doses of vitamins and minerals. So with these different things, some of them have some research support for a subgroup of the population with only slight effects. So it means they're low probability, works for only a few people, very small effects. It's not really a good bang for your buck, okay? Yelling doesn't work, bribing doesn't work, lecturing your child doesn't work, threatening punishment that you don't follow through on doesn't work, grounding or big or long punishments don't work, taking away recess doesn't work, doesn't really help any kid to take away their ability to move and use their body. And blaming yourself as a parent or blaming your child definitely doesn't work. So, I will say one thing about the high protein diets. The reason high protein diets can be helpful is because they help avoid sugar spikes. So if a kid has poor impulse control, poor emotional modulation, and they just like downed like 3 pieces of cake, it's gonna show up. So the high protein diet doesn't change the brain, it just helps avoid the sugar spikes. Okay. So what I want you to think about is you are not the creator of the sheep. You didn't cause the ADHD, you can't necessarily change their brain, but you can be the shepherd of their environment. You can create the pasture where that sheep can be the most successful. All right, next slide. So one of the most important things you can do as a parent or a loved one of someone with ADHD is forgive yourself. Take care of yourself, find your own support. CHAD is amazing, it's an amazing resource, I'm so glad they're here. Forgive your child, don't blame them, they're not trying to make your life harder, they're not trying to struggle. Give them a lot of grace and help them build up on their own unique strengths. And then forgive the public because people are going to say dumb and insensitive things because they don't understand. So have grace for them, educate them, advocate for your child where you can. And if you want more information, you have some resources in your slides as well. All right.